And here we are on our second video, which is the thyroid. And if you see the screen, you're gonna say, "Oh my God, she just summarized in one slide." Yes, I did. Remember, we do not have to know everything, but we have to know the basic or the basic rule that will help us to um, extract all the other informations that we have to do. So instead of having a big summary or a big review, we're going to have just one small papers, which is the basic stuff that will help us to extract all the other information. And I'm here not to teach you, I'm not here not to give you the content because you have all the other content. I'm here to ease it or to simplify your NCLEX notes and to give you some ways that help you to remember. So like the Addison is like add S on, so we make it all about letter S, remember? So symptoms are less S, less salt, less solution, less steroids, the treatment is add S. In the thyroid, because it starts with letter T, everything I'm gonna say is about the T, which is turbo. So I want you in your head, thyroid equals turbo. Okay, so turbo is the speed, right? So if you have hypothyroid, your speed is low. If you have hyperthyroid, you have hyperturbo, the speed is high. So the only slide you need to memorize about the thyroid, which is the hypothyroidism and the hyperthyroidism. And you do not need to memorize all the list because sometimes they're going to give you symptoms which is not in the list that you memorize. So as long as you know the basic or the arrows, whether it's fast or slow, you're good. So let's start with the hypothyroid. So hypothyroidism, as I told you, T is going to be our indicator here to memorize everything. It's going to be hypoturbo, so the speed is low. So everything is low. So do you expect for them to become active or sleepy? Sleepy. Do you expect for them to have diarrhea or constipations? Constipations. Do you expect for them to have weight gain or weight loss? So everything is low. So they're going to be fat, they're gonna be slow, they're gonna be sleepy all the time. So everything is slow. So do you need to memorize a list? No, as long as you know what's the speed and then what's low and high, then you're good. The treatment is also with T, is thyroxine, levothyroxine, because that's the hormone, right? And we have low, so we are giving them replacement. Let's go on the other hand, hyperthyroid. Hyperthyroid, hyperturbo. So the speed is so high. So do you expect for the patient to have constipation or diarrhea? Diarrhea. Weight loss or weight gain? Weight loss. Appetite increased or decreased? Increased, right? So they're going to eat a lot, but they're losing also a lot because their metabolism is also high. Everything is high, hyperturbo. The treatment is also T. So PTU, and then transmissions iodine, which is transmissions is another name for radioactive iodine. So I just tried to search for the synonym of radioactive, which is transmission. So at least everything with the T's. That's an easy way for you to remember it. And then thyroidectomy. Thyroidectomy, whether it's partial or total thyroidectomy. So some people will have partial, so not all of them will be removed. Some of them will be have totally. But remember, one of the most important nursing consideration with the thyroidectomy is the parathyroid, because the parathyroid is located on the thyroid. So sometimes it have complications whenever it's removed. It's accidentally also removed, and the indicator for that is the calcium. And I explained the calcium and the symptoms with my electrolyte and symptoms videos. So that's all you need to know about the thyroid. So thyroid equals turbo, which is speed. Hypo, low speed. Hyper, high speed. So do you need to memorize the symptoms? No. So anything hypo, everything goes slow. Anything hyper, everything is so fast. The treatment also with T, with the hypo is thyroxine, with the hyper is PTU, and the transmission or radioactive iodine, and the thyroidectomy. So this is all you need to put in your summary. So what, and other will ask me, how about the other details? Of course, you need to be familiarized with it, but not memorize it. So you need to, like, you can read about it just to be familiarized in case it comes in the test. For instance, the other name for the hyper is Graves' disease. So that's why I'm telling you guys, you also have to check the synonyms, because sometimes they're not gonna give you the direct name, but they're gonna give you the synonym for it. And also the hypothyroidism. So this is all we need to know about the thyroid. And in a minute, or in a few while, I'm gonna upload the priority patients, or who do you see first.